Good morning. Today we are going to talk about sunburns as the sun is getting hot and it burns fast. And I'm seeing some people with sunburns walking around, so we're going to talk about them today and what to do if you get a sunburn. So, things to know, sunburns can occur very quickly. They can occur within 15 minutes of being out in the sun, especially during those really strong times of 9 to 2. We've talked about sunscreens in the past and how to avoid this, so you can look back at some of my old videos about sun protection. So if you are out, no sunscreen, a sunburn can happen very quickly, especially in your young ones who have that very fair skin, no sun exposure at all. They have to be extra cautious. Another thing to think about, which I always remind parents, is when you are by a pool or when you're at the ocean, the sun can actually reflect off the water and hit your baby in the face or your kids in the face. So you have your umbrella set up and you think you're doing a wonderful job, which you probably are, but then the reflection from the water, the sun's rays are reflecting and hitting them in the face. So just kind of be conscious when you're positioning things and see how the sun is getting them. Just a little tidbit pointer there. So, like I said, sunburn can take place in 15 minutes. Sometimes your symptoms don't develop, though, until 24 hours later. So you come in from the sun, you feel like you're okay. Next morning you wake up and you're like sunburn everywhere. So that is not totally uncommon to see as well. You can have a mild sunburn, which is just going to be like that redness you see, maybe a little bit of itching and a little bit of warmth to the area. Or you can have a more severe sunburn, which is where you see the blistering, the pain, tingling. You can even get swelling of the area, headaches, nausea, vomiting, dehydration, fevers. That's severe. That's not good. That's where you would want to call us or your doctor to help kind of work through that problem there. So what to do when you actually get the sunburn? You want to get out of the sun as soon as possible. If you are noticing a sunburn when you are outside, we need to get into shade. Get yourself or your children into shade as soon as you can. If you notice it in the morning when you wake up, try to avoid the sun that day. Extra shade protection hat, something. I mean, if you're on vacation, sometimes you just can't avoid the sun as best as you'd like. So just do your best. But if you are blistering and stuff, you have got to stay out of the sun. Apply cool compresses to the areas as tolerated. So maybe some cool washcloths, things like that. A direct ice pack might not feel that great on the skin there. Lukewarm baths are okay. You do not want to do a really hot bath, as that can burn and sting as well too. Aloe gel, very helpful. That can kind of help with the pain and the healing. You want to avoid any of the gels that say benzocaine topical in it, because it's a numbing agent is what benzocaine is, but it can sting a little bit, especially if you have a severe sunburn. So just be cautious with what aloe you're getting and what products you're putting on afterwards. Drink lots of liquids if you have a bad sunburn. If it's a little bit more that moderate and it's hurting, you can do some Tylenol, ibuprofen. If it is severe, you need to call your doctor and talk about steps and how to manage that. So that is my quick spiel for you guys on sunburns today. If this was helpful, give me a like or comment below so I know it's good. You guys have given me lots of great ideas for future videos, so these will be coming. Just stay tuned on Mondays. Have a great week, guys.